Science tells us the first 1,000 days of life lay the foundations for learning and well-being for the rest of life. Safeguarding children's development over this period should be of utmost importance. And yet, in South Africa, of the 6 million children under 5, less than 1 million are in registered ECD programs. Another 2.5 million are in unregistered ECD programs, with around 50,000 sites managing without state subsidies and monitoring, despite the crucial role they play. This was before the pandemic reached our shores. When it did, in early 2020, the sector nearly collapsed. Costly COVID-19 compliance requirements made it almost impossible for cash-strapped programs that served the poorest communities to reopen. And when the government first rolled out emergency support, unregistered ECD sites were least likely to access government support. Children are facing acute food insecurity. ECD programs are closing down, with thousands of staff losing their jobs and incomes. With this in mind, Ilifa Labantwana mobilized resources and partnerships, secured 36 million rand in funding, and teamed up with 3 NGO partners to initiate an ambitious ECD COVID-19 response project. The project had a dual purpose. First, address the humanitarian issues by getting ECD programs open safely, supporting staff and feeding children. And secondly, to use the project to tackle broader systemic issues within the sector.
There are a lot of barriers that prevent unregistered ECD sites from accessing support. So we really wanted to show that unregistered sites can comply with regulations if they're supported.
The really high rates of stunting in South Africa are extremely concerning. We're at 27% of children under 5 that suffer from stunting. And so ECD sites, we really feel that they should be a place where children are able to access nutritious meals, and the government should be supporting them to do that.
In a few short months, we achieved more than we thought possible, providing income support to 3,473 ECD staff and food support to more than 30,000 children. Support packs helped sites to reopen in line with health and safety regulations. By March 2021, almost all of the sites had reopened in compliance with government protocols. A major pillar of the project was the provision of digital food vouchers sent by SMS to participating ECD programs. The vouchers could be redeemed in local spaza shops to buy nutritious food for the children in the programs. Here, we wanted to test how ECD sites can become nutrition hubs with new local food supply chains created in the process.
Into ebalulekile uba abantwana masibatyise esikolweni. Siyasiqonda uba ngamanye amaxesha bamka ezindlini.
I-voucher indisebenzele kakhulu apha ikrishi because bendibethakala kwithuba lokutya. I-voucher yandisebenzela kakhulu.
The lessons we learned provide evidence for 3 recommendations that we believe, if implemented, will make a positive systemic impact on the whole ECD sector. Registered or not, ECD sites take care of hundreds of thousands of young children, and so should be supported by the state to deliver nutritional support to them. This way, we can address problems like stunting, malnutrition, and obesity. The voucher system showed there are different ways of getting funding to ECD sites that can be user-friendly and relevant. By designing processes that give us accurate beneficiary details, we can ensure the right people access payments and funds are used properly. Local ECD NGOs can play a critical intermediary role to help the state reach unregistered ECD sites with a range of support measures, while helping to maintain accurate and up-to-date data on these crucial areas. While the impacts of the COVID crisis have been devastating, it has shown that reaching unregistered ECD sites is both critical and possible. Let's invest in our collective future by working together to secure an equal start for all children in South Africa.
Umsebenzi endiwenzayo apha ubaluleke ekuhlaleni nasebantwaneni. kubazali, kwi-community nje seyiphelele.
Obviously, NGOs have played a major role in supporting unregistered ECD sites, but I think my hope is that the government would realize that unregistered ECD sites can be just as important, and they actually need the support, be it funding support or infrastructural support, and that they play a major role in the poorest of the poor communities in South Africa.
There's only so much you can do with 36 million rand, but the point is what you can do with the ideas and the mechanisms and the approach that we've shown can work. And that is that you can reach thousands and thousands of children by using an approach that works with local NGOs. And government really holds the power to do that at scale and to multiply the impacts of what we've been able to show in this project.